Hey mamas, welcome back. Today we are going to be going over some fetal tracing and monitoring. So there are a couple of ways that we can monitor baby during labor. Today we're going to be talking about external monitoring. So these are monitors that are going to be on your belly. I'm going to bring up my picture right here. So we have one monitor that we're going to be going on that is looking at your uterine activity. So the monitor is actually going to be placed at the top of your fundus, and that means the top of your uterus, so right up here. Now, when you are full term, your uterus, that top of the fundus, is going to be pretty high up here. So you'll have one monitor about here, and this is looking at your uterine activity. And what this will show us is if the belly or your uterus is tightening and relaxing. Now, when the monitor is on the outside, this is not going to tell us how strong the contractions are. It's only going to tell us if they are happening. There are other ways to monitor contractions, and we will talk about those in another video. Today, we're just talking about the external monitoring. So you have that one monitor that's on top of the fundus, which is the top of the uterus, looking at uterine activity, or that uterus if it's getting tight and what some people would call contractions. Another monitor that you're going to have on is tracing the baby's activity or the baby's heart rate. So that one is actually going to move around according to how your baby is positioned in your belly. Sometimes babies like to shift, sometimes they like to wiggle and move. So don't be alarmed if your nurse is coming in and moving that one around. That is just showing that your baby is in there having a grand old time.
And when you move, the baby moves. So
Absolutely.
Go ahead and get yourself into a comfortable position and then put the monitor on. Don't try to have the nurse put the monitor on and then get yourself comfortable or move.
Absolutely.
Because the baby's going to come off. We'll have to come back in and readjust it again.
Exactly, yes. That's a really good point, because if you move over to your side, that baby is going to kind of float up to that top, and then that monitor may have to be up here. And then if you moved over to this side, it's going to come on up here and be here. Sometimes you find baby real low, sometimes baby's up real high. So there are two different monitors. The monitor in the top of the uterus, or that fundus, is just measuring uterine activity.
And that's called the TOCO.
And the monitor that is going to be a little bit lower, that one is looking at baby's heart rate.
And that's called the ultrasound.